Welcome back. All right, 1 out of every 2 American adults aged 30 and over has some form of periodontal disease, according to recent findings from the Center for Disease Control and Prevention. Luckily, Dr. Richard Aguila, board-certified periodontist with Jacksonville Dental Specialists, is here today, part of our weekly Dental Health Watch segment, to tell you all you need to know about it. How you doing?
Doing great. How are you?
Good. Good to have you back on the show. So let's talk about this. Get right into it. What is periodontal disease and what causes it?
Yes. Periodontal literally means around the tooth. So what periodontal disease, it's a chronic infection of the supporting structures around the tooth, the gums and the bone, okay? So its primary cause is bacterial plaque, and what the plaque does, it irritates the gums, it produces toxins that get in between the tooth and the gums, causing the gums to become red, inflamed, and bleeds. And if that goes unchecked and causes the pocket to get deeper, it starts to affect the bone, okay? And how the bone reacts to these toxins, it deteriorates and goes away. So when it affects the gums and the bone, it's called periodontal disease, okay? And it usually manifests itself in a genetically susceptible individual. So there are also other contributing factors. So plaque is the primary cause, genetics plays a big role, but there are also factors listed here. Smokers are more prone to getting periodontal disease. Yep. Uncontrolled diabetes, stress has been shown to be a contributing factor. Clenching or grinding your teeth may make things worse as well. Certain medications may cause a lot of inflammation of the gums and poor nutrition. So the multifactorial nature of periodontal disease makes it, sometimes difficult to treat successfully for some patients.
Yeah, and as you saw in those graphics, it kind of is a progressive thing. It starts off, you may not realize what's happening. You're receding some gum line before you get to bone. Right. So what are the common signs or symptoms people should be looking for before it gets to that, as you saw in the pictures, just a gap?
Right. So periodontal disease is chronic, and oftentimes if you wait for pain or discomfort, is oftentimes too late. So we have a list of things here that you should look for when you're taking care of your teeth. If you have red or swollen or tender gums, if you get bleeding when you brush or floss your teeth, gums that you see are receding or separating from the teeth, if your teeth start to become loose or mobile, persistent bad breath is often a sign of periodontal disease. And just a change in the way your bite comes together shows some shifting. So these are all things that you should look for. If you have any of these symptoms, you should see a dentist, or more specifically see a periodontist, someone who specializes in the management and treatment of periodontal disease.
Because that's obviously the next question is how do you treat it? Because it is treatable, correct?
It is treatable, it's manageable. In the early stages, it's very predictable to treat. We often treat things as conservative as possible. Starts out with what's called scaling and replaning, some deep cleaning. We can use chemotherapeutics such as antibiotics, medicaments that we place into the pockets. When it starts to become more moderate to advanced, typically that's when I get involved as a specialist, and a lot of it depends on the patient, how well they respond. There's a more traditional approach to gum surgery, and then there's a more current approach to gum surgery. We like to use a laser, and the biggest advantage of the laser, it's minimally invasive, it addresses the bacteria, and it causes very little discomfort for patients.
So you use the laser to kill the bacteria?
Yes.
Nice.
It serves a couple purposes. It removes any of the diseased, inflamed tissue. It disinfects and destroys the bacteria that's in the pocket, and it also initiates the healing of the gum tissue to the tooth, which will reduce the pocket and help control the disease process.
So once you've gotten rid of the stuff that's diseased or bacteria, now the healthy tissue can regrow.
You establish health. Exactly.
Right. That makes sense. Easy enough. All right, this is really cool. We're getting towards the end here of the Hybrids for Heroes campaign. Coming down towards, have you guys picked out
we're down to our last week, I think. So at Jacksonville Dental Specialists, we decided to, for the holidays, have a campaign called Hybrids for Heroes. And it's basically providing a full implant reconstruction for
full mouth reconstruction
for a veteran. And the veteran must have an honorable discharge. They must be a citizen in good standing, financial hardship of some type. And we're taking applications, we're reviewing those, and we're going to bring them in for exams, and then we get to select one lucky recipient to undergo a full mouth reconstruction after the new year.
So this is the last week to get signed up?
This is.
Signed up for the drawing?
Yes, it is.
Very cool.
Yeah.
That's really cool you guys are doing that, and I know the veterans out there, somebody's going to have a really great Christmas gift here.
Absolutely.
Appreciate you being here, and we want to thank Jacksonville Dental Specialists for making this segment possible, and you can call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more at jacksonvilledentalspecialist.com. And I think the High Bridge for Heroes information is all on that website there, so check that out as well.